Hello everyone, my name is Favor. Welcome back to my channel. This video is going to be about how I passed the CNOR. A little bit about myself. I've been a nurse for almost 4 years. Been in the OR since October of 2022. CNOR is my second nursing certification. My first one was in med-surg. It's always been a goal of mine to also take the CNOR, and I did so May 28th, about 2 or 3 weeks ago now. This is the main page for the CCI website, the Competency and Credentialing Institute. They're the ones that administer the CNOR test. If you scroll all the way down, it shows all the tests that they offer. The main one we're discussing is the CNR, the Certified Preparative Nurse Test. The other one I'll be talking about in my next video is the Certified Foundational Preparative Nurse Test. So we just click on Certify. It brings us to the CNR specific page. As you can see, it's a 200 question test. You have 3 hours 45 minutes to complete the test. It's purely computer based. You can either take it at home with an online proctor, or you can go to an exam site where you can use their computer and all that. These are the subject areas. All of this is all covered on the Zander prep course if you do decide to take it. These are the eligibility requirements for taking the CNOR. You obviously need a nursing license. You want to be working in the OR actively, because a lot of the information definitely requires you to currently work in the OR. The last requirement is to have 2 years of OR experience with this many hours. The hours is usually not an issue, because if you're working full time, you're easily meeting these hours in a year and a half ish. If you noticed, I do not have 2 years of OR experience, but I was still able to take it out, and that's because I have the CFPN certification. So if you're somebody that you want to take the CNR early, I would suggest looking into the CFPN exam, and I'll be making a video on that next. So look out for that. This is just scrolling. Part of if you do decide to take the CNOR, you've already decided, yes, I want to take the CNOR. You need to know that you cannot take the test in the same month that you apply. So if you want to take it in August, you need to be registering in July. You cannot register in August and expect to take the exam in August. So plan accordingly. If you're someone that you think, okay, I might want to take it in October, I would not suggest registering in June, because guess what? If you register in June will be your month one. Then you have July, August, and September. So October would obviously be out of your 3-month testing window. So you definitely have to plan this ahead of time. Make sure that you're taking the test during a time where you can give some time and attention to studying for the test. Like I said, it's definitely not an easy exam, so you definitely don't want to rush your way through it. Down to the cost. Also not a cheap exam, but if you're working with a hospital that offers certification bonuses or reimbursements if you do pass the exam, don't look at the cost. And if you have anxiety about maybe not passing the test, I would register for this CNR Take 2. Now that you've registered for the test, it's time to talk about all the tools that I use to study for the test and pass it. My first tool that I use, the most important one, if there's nothing else you get from all of these tools I'm about to mention, you should get this one. It's the Zander prep course. It's $195. I think that's the cheapest one, but it covers you for 3 months, and you get her booklet, the PDF, and videos of her teaching all the topics in the course. I think she offers the in-person live version of the class and the online one. If you go online, like I did, you have access to the booklet, which is in PDF form for those of you that would choose to do it online. If you go in person, she usually does it as a 2-day back-to-back session, usually Saturday and Sunday, and then it's a full day of classes, like 8 to 5. I knew I was not gonna be I wasn't gonna be able to last 2 days of just information overload, so I decided to do it online. I would highly suggest doing it online. You still get the same information, and you get to watch the videos over and over again. Highly recommended. After each topic in her course, she has quizzes. So after each topic, you take a quiz so you see how you did, and she explains the answers of those quizzes after you're done taking the quiz. Definitely very helpful. I highly recommend that you take her course. Basically, 10 out of 10. This is what the Zander website looks like. You have to complete the evaluation to get your certificate. Mind you, completing this course gives you 16 credit hours. So if you're someone that needs CE hours to renew your license, or if your hospital requires it, this gives you 16 hours, which is a lot. This is what the course itself looks like. These are the topics. There's the first one's like test taken, sterile processing, surgical field, basically everything you need to know for the test. And these are the scores here for the quizzes. For every topic, there is a quiz afterwards, and she explains the rationale behind the answers and everything. Most of the quizzes I did pretty good in. The only one that I did really bad in was this one, 61%. It was about anesthesia. So just so you know, and that's what makes this test hard, is that you have to know not just what you personally do on a day-to-day basis, which is be a nurse in the OR. You have to know anesthesia stuff. You have to know some pharmacology. You have to know sterile processing. You also have to know some PACU and pre-op information. So definitely take your time studying for the test. The second tool I would recommend you guys using to study for the CNOR is to get some kind of practice exam question tool. When Zander offers her 200 question practice exam, it's an extra $50 if you decide to go with hers. If you go with the CCI like I did, it's also $50. I'm not sure about other companies, but those were the two main ones, and I decided to go with the CCI because they're the ones that make the exam, and I know for a fact that the wording of the questions are a lot more similar to the actual test than any other kind of questions tools I use to study for the test. It's 200 questions. You get 3 hours 45 minutes, just like the test. I highly recommend that if you're trying to study for this exam, don't just study. Take at least one or two 200 question practice exam before you try to go take the exam. And you don't want the first time you taking 200 questions to be on the actual test. I highly recommend the CCI product. This is what the online practice exam looks like. As you can see, I completed the exam May 25th, 2024. I took my test on the 28th. So if I click on relaunch, it shows basically the questions I had. This is my second time taking the test, by the way. That's why I say it's time taking 40 minutes. The first time I took it, I only got like a 60%, and it took me almost 2 hours. So don't look at this and think I'm this smart. I'm smart, but not this smart. This is some of the questions that are asked. I'm just gonna scroll through a little, but just in case you're wondering what the website looks like if you're gonna get the CNOR online practice exam question. The last tool I used to study for the exam is this book, the Alexander Care of the Patient and Surgery book. You really don't need it. This is one of the 4 textbooks that the exam questions are taken from, but I found it very useful studying for the sterile processing part of the test. Because again, if you're in the OR, you probably you don't even know where your SPD department is in your hospital, or if you even know, it's not a place that you've been in more than once. I know my hospital gave us a 1-day rotation down there. I found that that's the only section of the exam that I actually needed to study for, and I would highly recommend it. So if you're someone that maybe you don't work in a big hospital, or you're you work for a specific department, and that's another thing with this test. I'm a general surgery nurse. I do general surgery, trauma, transplant, vascular. I don't know nothing about ortho, neuro, and some other departments in the OR. But guess what? You're gonna get questions on every type of surgery if you're that lucky. So it's important that you have some type of book. In conclusion, I would suggest that if you're gonna take this test, you register for the Wendy Zander prep course. You pay for the 200 practice question exam offered by the CCI. If you have those two, and as long as you're an OR nurse that is working day to day with patients, you would know the basic knowledge that it takes to pass the test. But for sure, give yourself at least 3 to 4 weeks. Once you take the When Designer Prep course, schedule your exam for like 4 or 5 weeks, 4 or 5 weeks out, just depending on how much time you have to study for the test. I took my test at home with an online proctor. You have 3 hours 45 minutes for the exam, only one 10-minute break. Make sure that your computer is compatible with their system. I believe I have a MacBook Air and I had no issues with it. Basically, if you're an OR nurse that's on the fence about taking the CNOR, I highly suggest you do it, especially if your hospital is reimbursing you or giving you a bonus if you pass a test. I know my hospital offers a certification bonus for passing the test, so I would not leave that kind of money on the table if that's offered to you at your hospital. It's definitely not an easy exam, but I guarantee you will gain a lot of knowledge that's going to help you in your day-to-day nursing practice. So definitely look into seeing how you can take the test if you are an OR nurse. Thanks for watching. Like, comment, subscribe if you feel inclined to.